Assalamu alaikum students. Today our topic of discussion is dead space, and it is the third lecture on respiration. After covering the mechanics of ventilation and pulmonary volumes and capacities by spirometry, now we will study what is dead space. So dead space is actually of two types, physiological and anatomical dead space. So the anatomical dead space is the area where there is no gaseous exchange, and physiological dead space is the area where you have anatomical dead space as well as the area including where there is gaseous exchange, because the physiological means function, so the main function is gaseous exchange. So in a physiological dead space, the area of gaseous exchange is also included in addition to anatomical dead space. So we will study these topics. So you can see here about the alveolar ventilation. The ultimate importance of pulmonary ventilation is the continual renew of the air in the gaseous exchange areas of the lungs where air is in proximity to pulmonary blood. These areas include the alveoli, alveolar sac, alveolar ducts, and respiratory bronchioles. The rate at which the air reaches these areas is called alveolar ventilation. So some of the air, dead space and its effects on alveolar ventilation. Some of the air in a person's breath never reaches the gaseous exchange areas but simply fills the respiratory passages where gaseous exchange does not occur, such as nose, pharynx, and trachea. This air is called dead space air because it is not useful for gaseous exchange. So this is the anatomical, the anatomical dead space. And on expiration, the air in the dead space is expired first before any of the air from the alveoli reaches the atmosphere. Therefore, the dead space is very disadvantageous for removing the expiratory gases from the lungs, because the dead space provides resistance to the air in the alveoli, because the alveoli in the air in the alveoli is below, and on upper side of the air in the alveoli is the air in the dead space. So as you know, firstly there is nose, then pharynx, then trachea, and then alveoli. So the air in the nose, pharynx, and trachea provide resistance to the air in the alveoli when the air moves into the atmosphere. So this dead space is disadvantageous. And what is the anatomical and physiological dead space? You can see here. This method just described for measuring the dead space measures the volume of all the spaces of respiratory system other than the alveoli and their other closely related gaseous exchange areas. This space is called the anatomical dead space. On occasion, some of the alveoli themselves are non-functional or only partially functional because of absent or poor blood supply through the adjacent pulmonary capillaries. So actually, I have told you that the anatomical dead space includes the air in the nose, pharynx, and trachea. But when some of the alveoli become non-functional, which may be due to the poor blood supply, so these alveoli become non-functional, and they also become the part of anatomical dead space. Therefore, from a functional point of view, these alveoli must be considered dead space. When the alveolar dead space is included in the total measurement of dead space, this is called physiological dead space. So the physiological dead space also includes the alveolar dead space as well, where there is gaseous exchange. In a normal person, the anatomical and physiological dead space are normally equal because all alveoli are functional in the normal lung. But in a person with partially functional or non-functional alveoli in some parts of the lungs, the physiological dead space may be as much as 10 times the volume of the anatomical dead space. So normally the anatomical and physiological dead space is normal or equal. So when there are diseases or there are problems, then the anatomical dead space increases and physiological dead space decreases. So you can see here that when there is any pulmonary disease, you can see that the anatomical dead space remains constant, because the anatomical dead space is the dead space of nose, pharynx and larynx. But the physiological dead space also includes the alveolar dead space as well. Okay, and the amount, that is very important, MCQ, that what is the normal dead space volume? That is 150 ml in young adults, and this increases slightly with age, because with the age, you know that the alveoli become non-functional and the dead space become increased. And now where we can use this dead space? This dead space can be used to measure your alveolar ventilation. So that is our main topic, that is alveolar ventilation. So rate of alveolar ventilation. Alveolar ventilation per minute is the total volume of air, volume of new air entering the alveoli and adjacent gas exchange areas each minute. And it is equal to respiratory rate times the amount of new air that enters these areas with each breath. So VA is equal to frequency into tidal volume and minus dead space volume. So you can see here the frequency of respiration per minute is about 12 breaths per minute, and the tidal volume is you know that 500 ml. In the previous lecture you have studied the normal amount of air inspired and or expired, and then that dead space, as you have studied, 150 ml. So when we solve this problem, it gives 4200 ml per minute. So the alveolar ventilation is one of the major factors determining the concentration of oxygen and carbon dioxide in the alveoli. There are for almost all discussions of gaseous exchange. In the following chapter on the respiratory system, emphasis alveolar ventilation. So you should know about the concept of alveolar ventilation, as in the coming chapters we will have a more emphasis on alveolar ventilation.